Question 1. A sterile processing department, SPD, technician is assembling a tray requested for an upcoming maxillofacial reconstruction procedure. The surgeon requires a specific powered instrument designed to repair and reconstruct jawbones and teeth. Which device should the technician include in the setup? A. Sebetome. B. Dermatome. C. Dental drill. D. Sternal saw. Correct answer C. Knowledge point explanation. Core rationale. Dental drills are precise powered surgical instruments specifically engineered for specialized work on teeth and the surrounding jawbones, maxillofacial area. They are essential for reconstruction and repair in dental and oral surgeries. Trap analysis. Option A is used for removing bone cement in orthopedics, not for dental work. Option B is for skin grafting. Option D is a heavy-duty saw for opening the chest cavity. Concept extension. Dental drills are typically electrically powered to provide the high-speed precision required for delicate bone and tooth work. They must be processed carefully according to the manufacturer's instructions for use, IFU, to protect their delicate internal turbines. Question 2. Which of the following powered surgical instruments is specifically designed for delicate procedures such as ear surgery and driving extremely thin wires through bone? A. Microdrill. B. Reciprocating saw. C. Sebetome. D. Dermabrader. Correct answer A. Knowledge point explanation. Core rationale. Microdrills are small, highly precise powered instruments used when surgeons need to work on very delicate structures, such as the tiny bones in the middle ear, or when inserting ultra-thin fixation wires into small bone fragments. Trap analysis. Option B is for cutting large bones back and forth. Option C is exclusively for removing hardened cement from previous joint replacements. Option D is used to sand or reshape the top layers of skin. Concept extension. Due to their miniature size, microdrills have extremely delicate attachments and collets. Even a minuscule amount of dried bioburden can cause the mechanism to jam, requiring meticulous manual cleaning and brushing of the collet area under magnification. Question 3. During the preparation for a coronary artery bypass graft, CABG, the operating room abruptly requests a heavy-duty powered surgical instrument to access the patient's heart. The device must be capable of smoothly cutting through the breastbone. Which instrument must the SPD technician pull for this case? A. Sternal saw. B. Sebetome. C. Oscillating saw. D. Microdrill. Correct answer A. Knowledge point explanation. Core rationale. A sternal saw is specifically designed to cut vertically through the sternum, breastbone, to split the rib cage, allowing surgeons full access to the heart and major vessels during open heart procedures like a CABG. Trap analysis. Option B removes bone cement. Option C cuts bone with a side-to-side blade motion typically used in orthopedics, not specifically tailored for splitting the sternum. Option D is far too small and weak for heavy bone cutting. Concept extension. Sternal saws can be powered by electricity, battery, or pneumatic gas. Because they are used in high-risk cardiovascular surgeries, verifying that they are completely free of bioburden and perfectly lubricated, if required by IFU, is absolutely critical to prevent operating room delays. Question 4. In complex orthopedic revision surgeries, older bonding materials often need to be cleared away from the bone cavity before a new joint prosthetic can be securely implanted. Which powered surgical instrument is uniquely designed to remove this hardened material? A. Dermatome. B. Sebetome. C. Dental drill. D. Sagittal saw. Correct answer B. Knowledge point explanation. Core rationale. The sebetome is a specialized powered surgical instrument utilized almost exclusively in orthopedic revision surgeries. Its specific mechanical action is designed to safely break up and remove old, hardened bone cement without causing excessive damage to the surrounding healthy bone. Trap analysis. Option A is for harvesting skin. Option C is for dental and jawbone reconstruction. Option D is a saw that cuts on a forward axis, used for bone resection, not for precisely chiseling out old cement. Concept extension. Removing bone cement generates a significant amount of fine, abrasive dust and hard fragments. This debris can easily get trapped in the moving parts of the sebitome, making thorough cleaning of its chuck and attachments highly challenging. Question 5. A patient who suffered severe thermal burns over 30% of their body is scheduled for an extensive skin grafting procedure. The surgical team requires a specific powered instrument that can harvest incredibly thin, uniform slices of healthy skin from a donor site, e.g., the thigh, measuring precisely 0.015 inches thick. Which device should the technician prepare? A. Sebitome. B. Microdrill. C. Dermatome. D. Sternal saw. Correct answer C. Knowledge point explanation. Core rationale. A dermatome is a specialized surgical instrument used to produce thin slices of skin from a donor area to use for skin grafts. It allows the surgeon to set a precise depth, such as 0.015 inches, to harvest only the top layers of skin without cutting too deeply. Trap analysis. Option A removes bone cement. Option B drills into delicate bone. Option D cuts through the chest bone. None of these have the blade mechanism required for soft tissue harvesting. Concept extension. Dermatomes often have highly sensitive blade guards and thickness adjustment dials. During reprocessing, personnel must be extremely cautious not to bend these guards, as even microscopic misalignment will cause the instrument to cut the patient's skin at the wrong thickness. Question 6. A surgeon performing an amputation requires an instrument that delivers a very specific side-to-side or back-and-forth cutting action to resect the bone cleanly. Which powered surgical instrument should the sterile processing, SP, technician provide? A. Dermatome. B. Rotary microdrill. C. Surgical saw. D. Sebitome. Correct answer C. Knowledge point explanation. Core rationale. Surgical saws are specifically engineered to perform distinct linear cutting actions, such as oscillating side-to-side or reciprocating back and forth, to efficiently cut through dense bone during orthopedic procedures. Trap analysis. Option A is incorrect because it is designed to harvest thin slices of soft tissue. Option A would be correct in a scenario involving a burn patient requiring a skin graft. Option B is incorrect because it uses a circular spinning motion to bore holes, not make flat cuts. Option B would be correct in a scenario where a surgeon needs to drive a thin wire through middle ear bones. Option D is incorrect because it is used to chisel away hardened bonding materials. Option D would be correct in a scenario involving a total hip revision surgery where old bone cement must be removed. Concept extension. Surgical saws generate significant friction and heat, meaning they often require specific sterilization parameters, such as extended pre-vacuum steam cycles at 270 F, to ensure proper sterilant penetration and drying. Question 7. During a heavy-duty total joint replacement, the surgical team requests a powered instrument that allows maximum mobility around the sterile field without the interference of dragging cords. Which power source is typically utilized for instruments designed for large bone surgery? A. Alternating current. B. Battery. C. Pneumatic gas. D. Low temperature plasma. Correct answer B. Knowledge point explanation. Core rationale. Battery-powered surgical instruments are primarily utilized for large bone surgeries because they eliminate the need for external cords or hoses, offering the surgeon complete, untethered freedom of movement when handling heavy tools. Trap analysis. Option A is incorrect because alternating current requires a power cord plugged into a console. Option A would be correct in a scenario asking about the power source for high-speed dental drills. Option C is incorrect because it requires a thick hose connected to a gas regulator, which restricts movement. Option C would be correct in a scenario where the facility prefers driving heavy instruments using compressed nitrogen. Option D is incorrect because it is a sterilization method, not an energy source. Option D would be correct in a scenario asking how to safely sterilize the moisture-sensitive battery packs themselves. Concept extension. To protect the internal mechanisms from fluid invasion during cleaning, a specialized decontamination battery must often be attached to the handpiece to create a watertight seal before any manual washing occurs. Question 8. A physician needs to remove a suspected tumor from a patient's lower gastrointestinal tract. The procedure requires passing a snare directly through the scope to the site. Which type of flexible endoscope provides the specific design feature required to perform this surgery? A. Operative endoscope. B. Diagnostic endoscope. C. Rigid laparoscope. D. Semi-rigid ureteroscope. Correct answer A. Knowledge point explanation. Core rationale. Operative flexible endoscopes are uniquely manufactured with an internal working channel. This channel allows physicians to pass surgical instruments, such as biopsy forceps or snares, down the length of the scope to perform surgical procedures. Trap analysis. Option B is incorrect because it lacks a working channel and is used strictly for observation. Option B would be correct in a scenario where a physician only needs to visually inspect the stomach lining without taking samples. Option C is incorrect because it is a rigid metal tube that does not bend. Option C would be correct in a scenario describing a minimally invasive abdominal surgery requiring straight, glass rod optics to view anatomy at a 0° or 30° angle. Option D is incorrect because it is exceedingly fragile and narrow. Option D would be correct in a scenario involving a procedure to view or operate within the narrow ureters or kidneys. Concept extension. The internal working channel of an operative endoscope poses a massive challenge for decontamination. It must be meticulously brushed with a precisely sized brush and flushed under fluid to prevent the accumulation of dangerous biofilm. Question 9. A sterile processing department, SPD, technician is inspecting the power cords of several high-speed drills destined for a maxillofacial procedure. Which specific power source is standard for these powered surgical instruments utilized in dental surgery? A. Compressed air. B. Electric. C. Internal battery pack. D. Regulated nitrogen gas. Correct answer B. Knowledge point explanation. Core rationale. Electric power is the standard source utilized for powered surgical instruments in dental surgery, as it reliably provides the high-speed rotation and extreme precision necessary for delicate work on teeth and the jawbone. Trap analysis. Option A is incorrect because compressed air is generally reserved for heavy orthopedic tools. Option A would be correct in a scenario discussing the pneumatic power source that requires pressurization testing for hose integrity. Option C is incorrect because battery packs are too bulky for microdental tools. Option C would be correct in a scenario describing large bone saws where maximum mobility is required. Option D is incorrect because nitrogen gas functions identically to compressed air. Option D would be correct in a scenario asking what specific gas is commonly used from a wall regulator to drive a pneumatic instrument. Concept extension. Electric dental handpieces are extremely susceptible to internal damage and must never be immersed in water or ultrasonic cleaners unless the instructions for use, IFU, explicitly permit it. Question 10. An emergency open heart surgery requires immediate access through the patient's anterior rib cage. Which specific type of powered surgical instrument must the technician rapidly process and dispatch for this cardiovascular procedure? A. Sternal saw. B. Sebetome. C. Operative endoscope. D. Dermatome. Correct answer A. Knowledge point explanation. Core rationale. A sternal saw is a specialized powered surgical instrument explicitly designed to cut vertically through the breastbone, sternum. This action allows surgeons the massive exposure necessary to perform complex procedures like open heart surgery. Trap analysis. Option B is incorrect because it is designed for breaking up orthopedic cement. Option B would be correct in a scenario where a surgeon is revising a failed total knee arthroplasty. Option C is incorrect because it is a flexible tube used for minimally invasive access. not bone cutting. Option C would be correct in a scenario involving the visual examination and biopsy of the colon. Option D is incorrect because it is used strictly for soft tissue. Option D would be correct in a scenario where uniform slices of healthy skin must be harvested for a burn victim. Concept extension. Sternal saws can be powered electrically, pneumatically, or by battery. Regardless of the power source, all detachable blades must be removed before sterilization to ensure steam effectively reaches all surfaces of the collet. Question 11. A sterile processing technician is preparing to process a heavy-duty orthopedic drill that is classified as a pneumatic device. Which specific medium must the facility supply to operate this instrument? A. Alternating electrical current. B. High-capacity lithium batteries. C. Compressed air or gas. D. Low-temperature steam. Correct answer C. Knowledge point explanation. Core rationale. Pneumatic-powered surgical instruments are designed to be driven entirely by compressed air or medical-grade gas supplied through a specialized hose attached to the device. Trap analysis. Option A powers electric instruments. Option B powers battery-operated instruments. Option D is a sterilization method, not an energy source for surgical tools. Concept extension. Because the pneumatic hose is critical to the instrument's function, it must be properly pressurized and inspected for leaks to ensure gas does not escape during surgery and fluids do not invade the motor during cleaning. Question 12. Which of the following statements regarding the frequency of leak testing for flexible endoscopes is correct? A. Leak testing should be performed exclusively on an annual basis. B. Leak testing must be performed before each manual cleaning cycle. C. Leak testing is only required if the physician reports a visible puncture. D. Leak testing should be performed after high-level disinfection is complete. Correct answer B. Knowledge point explanation. Core rationale. Flexible endoscopes are highly delicate and prone to damage. Therefore, leak testing is a mandatory first step that must be performed before every single manual cleaning cycle to detect any breaches in the outer sheath or internal channels. Trap analysis. Option A is dangerously incorrect. Annual testing would allow contaminated fluid to ruin the scope during thousands of washes. Option C relies on visual inspection, which cannot detect microscopic holes. Option D places the test too late. If a leak exists, fluid invasion will have already occurred during the cleaning phase. Concept extension. Detecting a leak early prevents major fluid invasion during immersion, which would otherwise lead to extremely costly repairs and the potential formation of irremovable biofilms inside the instrument's mechanical components. Question 13. A vendor delivers a loaned orthopedic implant tray to the receiving area just 2 hours before a scheduled surgery. The tray is fully wrapped in blue sterile wrap and clearly labeled sterile by the sending hospital. What is the mandatory next step for the receiving facility? A. Inspect the external package integrity and dispatch it directly to the operating room. B. Perform a rapid biological indicator test before dispensing the tray. C. Wipe down the external wrapper with a high-level disinfectant. D. Completely decontaminate, clean, and re-sterilize the instruments before use. Correct answer D. Knowledge point explanation. Core rationale. The receiving facility cannot verify the sterility assurance processes or the transportation conditions of the sending facility. Therefore, all loaned instruments must be considered contaminated and undergo a complete reprocessing cycle starting from decontamination. Trap analysis. Option A violates critical infection control standards by bypassing the facility's own sterilization verification. Option B is insufficient because a new biological test cannot validate a cycle run elsewhere. Option C only addresses the wrapper and ignores the unverified contents inside. Concept extension. Facilities must establish strict policies requiring vendors to deliver loaned trays at least 24 to 48 hours prior to the procedure to allow adequate time for proper disassembly, manual cleaning, mechanical washing, and sterilization according to the IFU. Question 14. What is the correct protocol regarding the internal channels of a flexible endoscope after the cleaning and high-level disinfection processes are completed? A. The channels should be flushed with saline and left moist. B. The channels must be thoroughly dried using filtered air. C. The channels should be filled with an enzymatic solution for overnight storage. D. The channels require no specific treatment if stored vertically. Correct answer B. Knowledge point explanation. Core rationale: moisture is a primary catalyst for microbial proliferation. Therefore, endoscope channels must be thoroughly dried using forced filtered air to prevent the growth of dangerous bacteria and biofilms during storage. Trap analysis: option A is extremely dangerous as saline causes corrosion and moisture promotes bacterial growth. Option C is incorrect because enzymatic solutions are for cleaning, not storage, and leaving them inside would cause severe patient harm. Option D is false because while vertical storage aids drainage, active air drying is still mandatory. Concept extension: many modern facilities supplement forced air drying with an alcohol flush, which mixes with residual water to lower its surface tension and accelerate the evaporation process inside the microscopic lumens. Question 15. An educator is instructing a new technician on the classification of heavy-duty operating room equipment. They ask the technician to list the 3 primary power sources that drive powered surgical instruments. Which of the following is the correct list? A. Electric, pneumatic, and battery. B. Ultrasonic, alternating current, and steam. C. Nitrogen, hydraulic, and electric. D. Battery, solar, and compressed air. Correct answer A. Knowledge point explanation. Core rationale: powered surgical instruments rely on one of 3 standard energy sources to operate their internal motors and gears: electric, pneumatic, or battery. Trap analysis: option B includes sterilization and cleaning methods, not power sources. Option C incorrectly lists hydraulic power, which is not standard for these surgical handpieces. Option D incorrectly lists solar power, which is not utilized in the operating room for surgical drills. Concept extension: identifying the specific power source is the very first step in reprocessing, as it dictates whether the device requires specialized decontamination caps, cord inspections, or specific fluid immersion restrictions according to the manufacturer's guidelines. Question 16. A new sterile processing (SP) technician is assigned to the assembly area and prepares to process a newly purchased battery-powered orthopedic saw. The technician assumes all moving metal parts require oiling and prepares to lubricate the device. What is the correct protocol regarding the lubrication of powered surgical instruments? A. All powered surgical instruments must be heavily lubricated before every sterilization cycle. B. Lubrication should only be performed if the specific manufacturer's instructions for use, IFU, explicitly require it. C. Battery-powered instruments are permanently sealed and never require any form of lubrication. D. Lubricant should be applied directly to the electrical contact points to prevent corrosion. Correct answer B. Knowledge point explanation. Core rationale: lubrication requirements for complex surgical devices vary drastically between different models and brands. Some require specific oiling, some are permanently self-lubricating, and others strictly forbid it. Therefore, the technician must precisely follow the manufacturer's instructions for use, IFU. Trap analysis: option A is false because blindly lubricating all instruments can gum up internal motors that are not designed to receive oil. Option C is false because some battery-powered handpieces do require lubrication. Option D is extremely dangerous. Putting oil on electrical contacts will insulate them, causing the instrument to fail or short-circuit. Concept extension: if lubrication is required by the IFU, the SP technician must only use the specific type of sterilizable, medical-grade oil recommended by the manufacturer, as industrial lubricants will interfere with the steam sterilization process. Question 17. During a minimally invasive laparoscopic cholecystectomy, the surgeon utilizes an electrosurgical grasper to cauterize tissue. Unbeknownst to the surgical team, the instrument's protective shaft coating has a microscopic pinhole defect. What is the most severe risk associated with this insulation failure? A. The instrument's mechanical jaws will jam and fail to release the tissue. B. Stray electrical current can escape through the crack and cause severe burns to non-target internal organs. C. The high-frequency electrical current will short out the operating room's main power supply. D. Condensation will build up inside the shaft and corrode the internal pull wires. Correct answer B. Knowledge point explanation. Core rationale. Laparoscopic instruments used with electrosurgery are insulated to deliver current safely to the tip. If the insulation is compromised, cracked or peeled, live electrical current can arc out of the defect and severely burn adjacent healthy tissue, like the bowel, outside the surgeon's field of vision. Trap analysis. Option A describes a mechanical failure, not an electrical insulation hazard. Option C is incorrect. The electrosurgical generator controls the power, and a pinhole will not short the entire hospital room. Option D describes a moisture issue related to steam sterilization, not the immediate danger of breached insulation during active surgery. Concept extension. To prevent these catastrophic patient burns, SP technicians must actively test the insulation of every applicable instrument using an electronic lap tester in the clean assembly area before it is packaged. Question 18. A technician is preparing to manually clean a battery-powered surgical drill in the decontamination sink. Before exposing the device to any enzymatic detergent solution, the technician attaches a specialized dummy decontamination battery. What is the primary purpose of utilizing this specific accessory? A. To provide low-voltage power so the internal motor can be flushed while running. B. To protect the sensitive internal electrical components and motor from fluid invasion during the cleaning process. C. To add sufficient weight to the handpiece so it remains completely submerged in the ultrasonic cleaner. D. To simultaneously recharge the instrument while it is being decontaminated. Correct answer B. Knowledge point explanation. Core rationale. A decontamination battery, or hose, creates a critical watertight seal over the power connection points on the instrument's housing. This physical barrier prevents water and corrosive cleaning chemicals from entering and irreparably damaging the delicate internal electrical and mechanical gears. Trap analysis. Option A is strictly forbidden. These instruments are not flushed internally while running. Option C is incorrect because powered instruments generally should never be fully submerged in an ultrasonic cleaner unless explicitly permitted by the IFU. Option D is physically impossible in a wet decontamination sink. Concept extension. Failure to utilize the decontamination battery results in fluid invasion, which is consistently ranked as the #1 cause of costly repairs and premature failure for powered surgical instruments. Question 19. An orthopedic surgeon is performing a complex total knee revision and encounters rock-hard, aged bone cement from the previous implant that must be cleared away. If a technician mistakenly provides a high-speed dental drill instead of a sebetome, why would this be incorrect for this specific surgical task? A. Dental drills operate using compressed nitrogen, but the surgeon requires an electric power source for cement removal. B. Dental drills are strictly designed for precision work on teeth and jawbones, whereas a sebetome is uniquely engineered to safely break up and remove hardened orthopedic cement. C. The dental drill requires a sterile decontamination battery to function, which is not available in the sterile field. D. A dental drill is classified as a semi-rigid endoscope and cannot cut through solid materials. Correct answer B. Knowledge point explanation. Core rationale. Complex surgical instruments are purpose-built. A dental drill is constructed with fine turbines for delicate oral reconstruction, while a sebetome is a heavy-duty orthopedic tool designed specifically with the force and attachments necessary to chisel away old bone cement during joint revisions. Trap analysis. Option A is false. Dental drills are overwhelmingly electric, not pneumatic. Option C is false. A decontamination battery is used during cleaning in the SPD, not for surgical functioning in the sterile field. Option D is nonsensical. A drill is a powered instrument, not a viewing scope. Concept extension. Using the wrong powered instrument on dense materials like bone cement can instantly shatter the delicate internal gears of the tool, like a dental drill, and create a severe safety hazard involving flying metal debris in the operating room. Question 20. An orthopedic surgeon utilizes an arthroscope to visually inspect the interior cartilage of a patient's knee joint. Which of the following statements accurately classifies this specific piece of equipment? A. It is a pneumatic surgical device driven by high-pressure compressed air. B. It is a flexible operative endoscope containing an internal channel for passing biopsy forceps. C. It is a rigid endoscope that utilizes an optical system to transmit light and images, and is not powered by air or electricity. D. It is an electric-powered surgical instrument used primarily for drilling bone. Correct answer C. Knowledge point explanation. Core rationale. An arthroscope is a rigid viewing instrument, endoscope, specifically designed to peer into joint spaces. It relies on a delicate internal system of glass rod lenses to transmit high-definition images and connects to an external light source, rather than possessing its own internal motor or power source. Trap analysis. Option A and D describe powered instruments, like saws or drills, which cut tissue rather than view it. Option B describes a flexible scope, like a colonoscope. An arthroscope uses straight, rigid metal shafts to puncture into the joint capsule. Concept extension. Because the arthroscope contains highly fragile glass rod lenses, it must be handled with extreme care during transport and decontamination. Dropping or sharply bending the shaft will immediately shatter the internal optics, ruining the device. Question 21. A sterile processing (SP) technician is troubleshooting a heavy electric-powered surgical instrument that repeatedly short-circuits and fails after undergoing pre-vacuum steam sterilization at 270 degrees Fahrenheit, 132 degrees Celsius. Maintenance opens the casing and discovers severe internal corrosion and moisture damage. According to standard equipment vulnerabilities, what is the most likely cause of this specific failure? A. The internal seals protecting the components have worn out, allowing condensation to enter the device. B. The technician properly utilized a watertight decontamination battery during the manual cleaning phase. C. The instrument was exposed to compressed nitrogen gas instead of alternating electrical current. D. The device was mistakenly processed using low-temperature hydrogen peroxide gas plasma. Correct answer A. Knowledge point explanation. Core rationale. Electric instruments generate significant heat during operation and are subjected to high heat during steam sterilization. If the protective O-rings or internal seals are damaged or naturally wear out over time, moisture, such as condensation from steam or fluids from cleaning, can easily breach the casing and enter the device, causing devastating corrosion and electrical short circuits. Trap analysis. Option B is incorrect because properly utilizing a decontamination battery prevents fluid invasion. Option B would be the correct answer if asking how to protect the device. Option C is incorrect because nitrogen gas powers pneumatic instruments, and gas exposure does not cause moisture corrosion. Option D is incorrect because low-temperature methods are dry processes designed to protect delicate electronics, not corrode them with steam condensation. Concept extension. Routine preventative maintenance, PM, is critical for electric-powered instruments. Manufacturers mandate periodic PM schedules so biomedical technicians can inspect and replace these degradable seals before catastrophic fluid invasion occurs.